Hi, this is Riverside College of Health Careers, Riverside School of Professional Nursing, and this is the Nursing 300 Managing Care Leadership Lecture. So let's begin. We're going to start with Chapter 4, which deals with leadership and followership. The objectives are to delineate between formal and informal leaders, analyze the qualities and behaviors that contribute to effective leadership, examine the different styles of leadership, analyze the qualities and behaviors that contribute to effective managers, differentiate between managers and leaders, describe the duties of a manager based on the management principles. So, leadership and learning are indispensable to each other. What does this mean? To me, it means they are essential, important, and absolutely necessary. Leadership. So, what is leadership? The ability to influence the behavior of others. So, engaging others to work together effectively in pursuit of a shared goal, especially with patient care, is very important. Leadership is much broader than management. Managers need to be good leaders, but management itself is focused on specific goals, achievement of organizational goals. Leadership occurs when someone influences the behavior of an individual or a group. It could be for personal goals, goals of others. It can be because leadership is influential. And do you feel like you need to be a manager to influence someone? So, in order to lead, one must develop three important competencies. One is diagnose, which means you have the ability to understand the situation you want to influence. Two is adapt, make changes that will close the gap between the current situation and what you're hoping to achieve. And three, communicate. If you do not communicate effectively, you will most likely not achieve your goal. Are you a winner or a whiner? So a winner says we have a real challenge here. I'll give it my best. That's great. We can do it, yes. A whiner says this is really a problem. Do I have to? That's nice, I guess. Impossible, it can't be done, maybe. So remember, an effective leader is optimistic. Can you recall how it felt working with a winner? Can you recall working with a whiner? So there's several different leadership theories. We'll discuss trait theories, behavioral theories, task versus relationship theories, motivation theories, and emotional intelligence theories. So consider how leadership theories will help us identify the qualities and behaviors of effective nurse leaders. So traits of leaders. Trait theories imply that leadership may come more easily to some than to others, but anyone can be a leader if you're given the knowledge and opportunities to develop your leadership skills. So, in your book on page 59, there's a discussion of a 5-year study of 90 outstanding leaders, which was done by Warren Bennis. This study identified 4 common traits among leaders. The first trait is management of attention. So the leader with this trait communicated a sense of goal direction that attracted followers. The second trait is management of meaning. This leader created and communicated meaning and purpose. The third trait is management of trust. These leaders are reliable and consistent. The fourth trait is management of self. These types of leaders know who they are, they understand their own styles of leadership, and work within their strengths and weaknesses. Behavioral theories are concerned with what the leader does, and they focus on the leadership style of the leader. There's autocratic, democratic, and laissez-faire. Table 4.1 is listed here, and that's from page 59 of your book. It has a good description of the different types of leadership styles. The first one is authoritarian or autocratic, which this type of leader tries to move the group toward their own goal. They're fairly controlling. They want total authority over decision making with little input from the team or subordinates. They like to give orders. They make decisions for the group. Usually they say, I've made the decision too, or I've decided that this is the way we're going to do it. Although this style may be highly efficient, what does this leadership style lack? It does not focus on input from the team, including creativity. The style can reduce team member motivation and/or suggestions for future changes or improvements in solutions. It can produce possible negativity and deflation within the team. The democratic leader tries to move the group toward a goal. This style is known as a participative or share leadership. Decisions are made with team participation and input. This style is more flexible and usually increases motivation and creativity. It gives team members a voice, a thought, and allows action, makes workers more productive, and encourages participation within the team. Although this style may be less efficient, consider what benefits this leadership style has. Benefits include team support on decisions made. What hinders this type of leadership style? Well, decisions can take longer due to team input. The laissez-faire leader makes no attempt to move the team at all. So they're known as permissive or non-directive, basically letting someone else do the work. This type of leader does very little planning or decision making. They fail to encourage others and wait for planning and decision making to happen on its own. They tend to postpone decision making or never complete it at all. Team members feel confused or frustrated. Why do you think people would feel this way? This leader provides no goals, no guidance, no support, and no direction. Most people do not do well under this type of leadership. Which leadership style would you want to work under? And which leadership style would you want to possess yourself? So there's several more additional leadership styles and leadership theories. There's task versus relationship theories, which some nurses focus on the skill or task to be performed, and yet they fail to recognize that interpersonal relationships affect the morale and productivity of employees. So some nurse leaders focus only on the task, such as giving meds and documenting within patients' charts, and other leaders focus more on the attitude of physicians towards nursing staff or the treatment of housekeeping staff by nurses, etc. The leaders who focus on interpersonal relationships tend to ignore or neglect the quality of the job being done, as long as people got along with each other. The effective leader is able to balance both the task and relationship aspects of working together. So motivation theories and styles, there's 3 leading motivation theories that we still use today, which are mentioned on page 61, figure 4-2. So the first motivation theory is Maslow's theory of the hierarchy of needs, which we should know by now. It's physiological safety, belongingness, esteem, and self-actualization. The second one is from Herzberg, Masnarand, and Snyderman's theory, which is in your book as well. It's based on 2 factors that influence motivation. So there's hygiene factors and there's motivators. Hygiene factors are based on like company policy, how people are supervised, the interpersonal relationships, working conditions, salary. Motivators are like people's achievements, recognitions, the work they do, the work itself, their responsibility, how's advancement in the company. So they found that the absence of hygiene factors can create job dissatisfaction, but their presence does not motivate or increase satisfaction. The third theory, which is called McClelland's motivation theory, is based on 3 dominant needs. The need for achievement, which performing tasks are on a challenging and high level. The need for affiliation, which gives good relationships with others. And then the need for power, which is being in charge. Now on to emotional intelligence theory or style. The emotional intelligent leader recognizes and understands their own emotions. They're able to manage their emotions, stay calm, clear-headed during a crisis until all facts are available. They also accept constructive criticism. They ask for help when needed, turn problems into opportunities. And these leaders are also excellent listeners. They're able to recognize unspoken concerns, acknowledge other concerns, and work towards achieving team goals. Situational styles or theory, they recognize the rapidly changing complexity of work situations and encourages leaders to consider many factors when deciding what action to take. They're adaptable. So adaptability is the key to any situational approach and learning to understand all the factors that affect the group and environment. Assess the readiness of the follower in regards to the task. Readiness equals determining if the follower demonstrates the ability and willingness to accomplish the task, which can range from unable, unwilling, and insecure to able, willing, ready, or confident. The leader will have to spell out the duties and responsibility to the person or group. What will the leader's behavior range from? Leaders' behaviors will range from telling, guiding, and directing to delegating, observing, and monitoring. Where did you fall in this range during your first clinical rotation? What about now? Transformational theory emphasizes on people that need a sense of mission that goes beyond interpersonal relationships or a pat on the back. So how does this especially hold true for nursing? Nurse leaders are responsible for helping nurses see that their work helps them or guides them to their vision. These leaders share or communicate their vision in a manner that is meaningful and exciting. It reduces negativity and inspires commitment within the team. A great leader shares his or her vision with the followers. So there's also what's called BHAG, or Big, Hairy, Audacious Goals. They are big ideas and visions for the future, utilizing your own imagination, creativity, planning, and persistence. Do you have a BHAG or BHAG? How would you make it real? Next is moral theory, which involves deciding how one ought to remain honest, fair, and socially responsible under any circumstances. Caring about the people you are taking care of and the people that work for you as an employee. Caring leadership theory, which is the one that I like the best. It's derived from servant leadership and emotional intelligence and is fundamentally people-oriented. Servant leaders choose to serve first and lead second, making sure people's needs within the work setting are met. Emotionally intelligent leaders are especially aware of not only their own feelings, but others as well. Caring leaders respect their coworkers. They listen, maintain awareness of their own and others' feelings. They empathize, develop their own and their team's capacities, and they are competent in leadership and in clinical practice. So, qualities of a leader. Integrity is expected of healthcare professionals. Patients, especially, as well as colleagues and employers, all expect nurses to be honest, law-abiding, and trustworthy. Adherence to a code of personal ethics and professional ethics is expected of every nurse. Courage involves taking risks when necessary. Positive attitude makes a great leader. Many outstanding leaders cite negative attitude as the single most important reason for not hiring someone. Many times the follower will pick up on the leader's attitude more than the leader's own actions. Leaders who have initiative feel good ideas are not enough. They don't just come up with great ideas, they act on them. It takes effort to be a leader and follower, and energy is a requirement of both, but use it wisely. The ability to see a problem as an opportunity is part of the optimism that makes a person an effective leader. It's easy to become discouraged when situations are rapidly spiraling out of control. Don't let discouragement keep you from plotting ways to solve the problem. Effective leaders do not give up easily. They persevere and understand that persistence pays off. Good leaders are generous and share credit for success and for those who are supportive. Leaders share their time, interests, and give assistance as needed. Just like patients and colleagues, don't forget about family and friends. They are just as important. Find your balance between work and play. There's also stress with every job. Coping helps conserve energy if done in a positive and healthy manner. Good leaders also focus on self-awareness. Know yourself. Don't limit yourself because this will limit your understanding of others. It's easier to be fair with a coworker than when you don't. Behaviors of an effective leader. Setting priorities. Continuously evaluate what you need to do. Delegate your tasks. Estimate the time to complete tasks. This will help you achieve your goals. They think critically. So they're careful and deliberate when reaching a decision about something. They have the willingness to ask questions and are open to new ideas and ways of doing things. They avoid assumptions and biases. Effective leaders solve problems. Patients, paperwork, staffing all contribute to creating problems and need to be solved. An effective leader helps identify the problems beforehand and then work through them. They respect and value individuals and their differences. Effective leaders recognize the difference in people and help them find rewards in their work that mean the most to them. They communicate skillfully. They're good at listening to others. Not listening can cause leaders to fail. They hear people but don't truly listen. Encourage exchanging information. They keep channels of communication open and encourage staff to use these channels. They provide both positive and negative feedback frequently. They help staff understand where individual improvements are needed and how effective their performances are with their work. They share their visions. Effective leaders set goals and should communicate them with their staff. This will help involve everyone in working toward a vision and goal. They develop themselves and others. Learning does not end when you leave school. Prepare yourself to continue learning throughout your career. Healthcare is changing daily and there's always something new to learn. Effective leaders continue to learn and encourage others to learn and encourage others to seek more knowledge. So, followership. Without followers, one cannot be a leader. However, one also cannot be a follower without having a leader. So, both roles are equally important. Most of us are followers. Examples are staff in a unit, attendees at a meeting, members of a team. The most valuable follower, though, is skilled, self-directed professional, actively participates in determining groups' directions. They're invested. They actively invest their time and energy in the work of the group, and they think critically and advocate for new ideas. How to become a better follower. Make suggestions. If you discover a problem, inform your team leader right away. Even better would be to bring a solution for the problem. Don't just bring the problem, invest your interest and energy. Be supportive. New ideas, suggestions from others. When you disagree, tell why. Listen carefully. Reflect on what your leader or manager says to ensure you understand. Continue to learn as much as you can about your specialty area. Become involved. Share what you learn. Being an effective follower not only will make you a more valuable employee, but will also increase the meaning and satisfaction that you get from work. Managing up is the process of consciously working with your manager to obtain the best results for everyone involved. Every professional nurse needs leadership and followership skills to be effective. Use this process to guide you with understanding your manager, their expectations of you, and what their own expectations are of themselves. A good follower recognizes the strengths and weaknesses of their manager and helps the manager capitalize on areas of strength and compensate for areas of weakness. Help your manager compensate for weak areas. If there are projects managers are struggling to complete on time, then offer to help. Keep your manager informed. No one likes surprises, especially if your manager finds out that a staff member has been doing something for a while that you've known about for a while and not said anything. But when you bring a problem, try to bring a solution and show your appreciation whenever possible. Respect your manager's authority and appreciate what your manager does for the staff on the unit. Take the appreciation up to the next level and then the next level above that. All right, now we're moving on to chapter 5. This is the nurse as a manager of care. So ask yourself right now, do you feel you're ready to be a manager? Do you have what it takes as a new nurse to graduate and be a manager? New nurse graduates are not ready to be managers. However, once you have had time to develop your clinical and leadership skills, then you can think about taking on the responsibilities of a manager. Some new grads are trained as charge nurses after 6 months. What do you think about that? Table 5.1 is from page 72 of your book. It lists the differences between a leader and a manager. Once you've had time to develop your clinical leadership skills, then begin thinking about taking on management responsibilities, such as taking on the role of a charge nurse. So in this table, there's differences between leadership and management. Leadership is based on influence and shared meaning, an informal role, an achieved position, part of every nurse's responsibility, requires initiative and independent thinking, whereas management is based on authority. It's a formally designated role, an assigned position, usually responsible for budgets, appraising, hiring, and firing people, and improved by the use of effective leadership skills. Management. What is management? It's getting work done through others. It is planning, organizing, commanding, coordinating, and controlling the work of a group of employees. Do what is needed to assist employees to work well. There's several different types of scientific management theories. The first management theory is scientific management theory. So work in this theory is analyzed to improve the efficiency of staff. Increasing productivity is the goal. Workflow and time to complete tasks are also measured and evaluated. Nurse managers who use the principles of the scientific management theory will pay particular attention to the types of assessments and treatments done on the unit, the equipment needed to get them done efficiently, and the strategies that would facilitate more efficient accomplishment of these tasks. Many nurse managers keep careful records of the amount of work accomplished and reward those who accomplish the most. Do you think this is true on the units you have been on? Human relations-based management theory X. So there's theory X and theory Y. So the first theory, X, it reflects on the thought most people do not want to work very hard, and the manager's job is to make sure that they do. Very controlling, they're the supervisor, they're punishing. That's all basis of this theory. It reflects a common attitude among managers that most people do not want to work very hard, and it's the manager's job to ensure that they do. Managers feel the need to employ strict rules, provide constant supervision, micromanage, and threaten to punish to create industrious and conscientious workers. Now, human relations-based management theory Y is the opposite viewpoint of theory X. Work itself can be rewarding and people really want to do their jobs well. Staff are supported by using guidance, development, and reward. Managers believe that the work can be motivating in itself and that people will work hard if their managers provide a supportive environment. Manager emphasizes guidance rather than control, development rather than close supervision, and reward rather than punishment. This manager's concern is to keep the morale high and have satisfied employees. What the employee thinks, feels, attitudes, and opinions are important to this manager. Servant leadership management theory believes people have values as people. They are not seen as just workers. Managers are committed to improving the way each employee is treated at work. The employees first, not the manager. Principles of management include authority, the right to direct other individuals and their activities, accountability, the ability and willingness to assume responsibility for one's actions and accept consequences of one's behavior, responsibility, the obligation to meet objectives, perform tasks, managing resources. They are accountable for the human, financial, and material resources, enhancing employee performance through the use of resources, information support, and opportunities for participation, building and managing teams, encouraging strong communication and considering this and how they work together, managing conflict, managing both resource conflict and personality conflict, managing time, setting goals, and prioritizing. So, an effective manager has certain qualities and certain behaviors. Qualities of an effective manager include leadership, clinical expertise, and business sense. People skills are essential. Effective leaders work on relationship building, teamwork, mentoring, advocating for staff, and support of nursing roles and ethical practice. Managers need to have clinical expertise. Without this, it is hard to help others develop their skills and evaluate how well they've done. It is important to be able to assess the effectiveness of their work and patient outcomes. They have a good business sense and know the bottom line in relation to cost of care and the benefits and costs involved for their care provided. Their job is complex and requires knowledge of budgeting, staffing, and measurement of patient outcomes. Consider how Riverside gets paid based on the HCAHPS scores that we talked about the other day from surveys mailed to patients. Reimbursement is a huge part of a manager's job. The bottom line is that it takes clinical skill, keenness, quickness to understand and deal with the business situation, along with leadership skills. Behaviors of an effective manager are divided into 3 categories, including interpersonal activities, decisional activities, and informational activities. Interpersonal activities include networking. They make contact with every service in a hospital setting, maintain line of sight or connection between what they do as managers, patient care, and the mission of the organization. They know how they interact with staff and administration and understand how those interactions affect the care that is provided to the patients they are ultimately responsible for. Conflict negotiation and resolution is something managers often encounter with patients, staff, and administration. Ineffective managers ignore people's emotions and/or mismanage feelings in the workplace. Employee development, they provide continual learning and upgrading of skills of their employees. Coaching, who is the most valuable asset to the company? Employees. Coaching by sharing their experience and expertise with staff. Nurture growth and development of the employee to do a better job through learning. Rewards and punishments. So salary increases, time off, Champion of Caring Awards, the Daisy Award. Punishments include that they would deny raises and promotions. Decisional activities include employee evaluations. Managers give feedback and in a way are similar to coaches and should give staff regular feedback. Resource allocation. Managers are given a budget. They must know how to allocate resources wisely. Hiring and firing, including creating new positions. Planning for the future. They look at changes in the budget, staffing, organizational priorities, and patient populations. Job analysis and redesign. Managers keep the workflow efficient within the unit while maintaining or cutting costs. Informational activities are based on the idea that managers are middlemen for information between staff and administration. They're a spokesperson, they speak for administration, and they speak for staff. Managers have to monitor everything. Nurse managers pick up information or problems before they grow too big. They have to know the daily census of the unit, anticipate staffing needs, budget and costs involved, and services provided. Reporting. Share information with staff, patients, and employers related to policy changes, new developments in healthcare, etc., staff meetings. And if you look at page 76, table 5-2, there's a good example in there of bad management styles. And really, managers need to have the skills of a leader. The amount of clinical expertise and knowledge that they have can be controversial, but some people believe you need to know how to do the task in order to guide those people who are learning from you. They need to know how to run a budget, follow organizational structure, and know how to evaluate. In conclusion, nursing management is a complex, responsible position. Ineffective managers may harm employees, clients, and organizations. All right, so NCLEX time. We're going to do a couple questions here. First one, a nurse manager has implemented a change in the method of the nursing delivery system from functional to team nursing. A nursing assistant is resistant to change and is not taking an active part in facilitating the process of change. Which is the best approach in dealing with the nursing assistant? Ignore the resistance. B, exert coercion with the nursing assistant. C, provide a positive reward system for the nursing assistant. Or D, confront the nursing assistant to encourage verbalization of feelings regarding the change. Okay, let's see what our answer is. D, confront the nursing assistant to encourage verbalization of feelings regarding the change. Okay, next question. A new unit nurse manager is holding her first staff meeting. The manager greets the staff and comments that she has been employed to bring about quality improvement. The manager provides a plan she developed and a list of tasks and activities for which each staff member must volunteer to perform. In addition, she instructs staff members to report any problems directly to her. What type of leadership style do the new manager's characteristics suggest? A, autocratic, B, situational, C, democratic, or D, laissez-faire? Your answer is A, autocratic. So to review, make sure to be able to delineate between formal and informal leaders. Formal leaders are appointed, informal leaders are not officially appointed. Make sure to examine the different styles of leadership. Differentiate between managers and leaders. So a leader is one who influences others to accomplish specific goals. A manager is someone who is employed by an organization to accomplish goals. Describe the duties of a manager based on the management principles. So authority, the right to direct other individuals and their activities. Accountability, the ability, willingness to assume responsibility for one's actions and accept consequences of one's behavior. Responsibility, obligation to meet objectives and perform tasks. Managing resources, enhancing employee performance, building and managing